Okay, my name is Awan Johnson, owner of Travelers Health and Wellness Group. And what we're going to do is we're going to find some organizational issues within Travelers Health and Wellness with some observable evidence and specific data to support our need for radical change in our procedures and protocol as it related to the pandemic known as the COVID 19. I have here our table of contents, and what we're going to attempt to do is go through a brief analysis, go over the history, some of the obstacles that we've had to deal with, support this with some evidence that has kind of forced us into the position of having to make such radical change. We too will identify some of the internal and external factors that contributed to the disruption within our organization. Our team members were feeling a certain way, and we'll go into that. I want to share with you also how significant the need to make this decision in a timely manner was. We used the appreciative inquiry model, and lastly, we can refer to the sources of my information and how I was able to be inspired and educated to come to the consensus that we came to. I want to share with you a brief analysis of our problem and our organization. Travelers Health and Wellness, we pride ourselves in the success that we've shared for many, many years with a team of nationally certified personal trainers, group fitness instructors, and massage therapists. We all offer an upbeat variety of programs that are effective, fun, motivating, and stimulating. As your fitness director, I oversee the fitness programming, the personal trainers, the group fitness instructors, and massage therapists, all of our staff that support our organization. And my attempt here is to ensure that all of our programming and quality of work is within the management's programming and agreed upon safety regulations and guidelines. In light of the COVID 19 global pandemic, we at Travelers Health and Wellness have identified the need for radically innovative change. And this change is going to require a new approach to our intimate engagement and has created the demands of a new protocol supporting adequate spatial awareness, what we classify as social distancing, and an increase of emotional and social IQ. This is a very important piece as it relates to our team members working together, as to them being able to translate this same energy and confidence into the clients that they serve. This is a very frightening time for so many people with the fear of, death and sickness associated with the COVID-19 global pandemic. We try to make every effort to make sure that our team members understand what our protocols are, and that's what our objective was in attacking this need for change. Our first obstacle was that we had to adopt new norms toward the services of massage, health and wellness, and fitness in general. Me and my team dealing with this had flamed an immediate resistance. Our first struggle was suffered from the low morale coming back, having sat quarantined for nearly 90 days. There was much lost income in managing how our team members, as myself, was able to provide for our families as to run an operation. There was the lost stability that we felt within the profession as to within our organization. There was a feeling of defeatedness. There was a resistance around why was this happening? What was the short and long-term perceived outcomes? We found all of our team members, as to myself, dealing with some of the cognitive rigidity associated with the change that was needed and expected. And certainly there was some mistrust in leadership. Was I capable of ushering our team into the next stage of this horrible pandemic that we didn't see coming? This mistrust also fell into my own self-reflection, and I had to understand, was I capable of bringing my team to where we needed to be successful? The supporting evidence here identified the pandemic, COVID-19 pandemic, and this pandemic would ultimately come to translate into a total overhaul of our procedures and protocol and cause us to revisit our mission, our vision of what moving forward looked like. The first thing we looked at was the external factors that affected our team as to our organization. The first thing was the global effect of this pandemic and what it had in the profession of massage and personal training, and what it required in way of training for the usage of personal protection equipment. How to use it, how to order the proper, how to manage the sanitation. These were things that, although they were internal operations, they were established by a global initiative described in all of the CDC reports as to what the governor's mandates were. Other external factors were the uncertainties that were associated with the industry of health and massage. This profession is a hands-on, a touch profession, and with the transfer of the COVID-19 virus, it was easy to understand how, the fears of being that close with a person who we weren't quite sure of what their health statuses were. But what we did understand too was the external factors of the moral obligation that we all had to contribute as much as possible and wherever we could toward preventing, fighting, and ultimately ending this tragic pandemic. The internal factors that we had to deal with would be the question that my team had was, as a provider, would I be able to manage the ebb and flow of the client demand? What happens where after 30 to 90 days of being sheltered in, will we have a major flow, or would it ebb into maybe one or two people a day or a week? And how would all of our providers be able to come back and successfully transition into the change that we was thrust into as to being able to provide for our families? This uncertainty, again, as identified in our external factors, was around the profession of health and wellness, but it also was around whether or not our organization had the capacity and the means to weather the storm. This required a new allocation of resources and personal commitments, as well as organizational investments. We suffered from a lack of revenue for nearly 3 months, and then there was a requirement of at least $10,000 to $15,000 of an investment in retrofitting to the new model of massage and exercise health. This pandemic left us all with a level of uncertainty toward, the health and massage profession. Would people opt out of the touch massage? And would they choose the non-cueing or closeness that the exercise health had always provided? Would the demands of the service be met with the time constraints adversely that required us to sanitize, do temperature measurements, along with other start and finish protocols? Would this cause us to increase our costs to try to match the loss of revenue due to the time allocations? We also had to factor in what time and patience that it took to communicate to our clients what their expectations were as clients dealing with the mitigation and limited risk of the COVID-19 pandemic. Again, this was a big problem. The change needed required a radically innovative approach, and our organization needed to buy in as a team. This needed to be supported by not only our cultural consistencies or things that we did on a regular that managed what our successes were, but it also required a major procedural overhaul. We had to understand as a team, as a management, as an owner, that we all had to commit to this obligation. This moral obligation to contribute as much as possible and wherever we could toward preventing, fighting, and ultimately ending this tragic pandemic also meant that we too had to build a fit and healthy, safe society within our organization, perfectly aligned with the duties that was really right up our alley as an organization when we were successful, and we could do it again. Again, this radically innovative approach required a clear commitment and communication for our need for change. What we did was we put together an initiative based on the appreciative inquiry model. What we did first was we had to clarify what the problem was to our team. COVID-19 had created a need for us to create new procedures and healthcare norms in order to maintain safety and mitigate the risk of passing on the virus or becoming infected with the virus. Many people had become infected with this, and it elevated our need to understand the need for extreme PPE usage and preventive practices. This was what my team suffered from and were fearful of, the discovery. And in our discovery process with this model, it was important for us to find what made this special. It forced us to rely on our stakeholders, rely on each other, to ensure the safety and health processes while still being able to share the gift of health, of exercise, of massage. This is what made us an essential contributor during this most horrific period. We had to dream a little bit. How would we increase our market share? Well, we had to envision ourselves in managing adaptability to the times. How quickly could we adapt to the needs of our clients? How quickly we ensure one another that we were going to practice all of our processes, whether we were observed or not? If we were deliberate in our execution of our new protocol, we would then gain the trust of each other, and we would reciprocate this trust to our stakeholders, the client. We see that this could only be done by being consistent, and the numbers would truly reflect that. This could work well, and it would work well in our transitions, still being able to fulfill 60-minute time slots, as to being able to earn without compromising the need for sanitation, the need for explaining to our clients, what the new protocols were, the post and pre-session processes. We were sure in our dream state that we would be able to come up with a program that would totally move us forward. In doing so, we assembled our team and we formulated a plan through a co-construction model involving complete team efforts. The team was a part of working through what the CDC data and the industry trends were, and we slowly developed some quality information that we had acquired during the period of that 3-month sheltering in process. Once all this was done, we were able to put together a deliverable. In doing so, we were able to manage the radical level of change that was needed, and we were able to manage understanding amongst our team members how this data and the combination of task force and small incremental changes could inspire our team and help us to understand the reason for the change, own the reason for the change, and allow us to put an open dialogue into building trust. What we were able to come up with is a ebook that we titled as Understanding Our New Norms, your guide to understanding new opportunities and challenges to overcoming the COVID-19. We made this work. What we did was we were able to, in the beginning of putting our task force together, understand the need for informing our team for the reason the change was so important. As we conducted meetings, we were able to address the questions and concerns, and we provided open dialogue. This built trust in our team members toward our organization, and it also allowed me to trust my decision-making process using healthy models. We evaluated, and the feedback that we got was awesome. Our organization, having been implemented the new protocol for less than a week, we found that these procedures had been a bit challenging for us being the change recipients as to me being the change agent. We meticulously evaluated the usage and consistency of our processes and protocol. The feedback that we got from our change recipients, our team members, was that it felt safer to work in an environment considering the risk associated with the contraction of the COVID-19 virus. Our clients gave us equal feedback with the same suggestion that they were able to relax and they were able to see how this type of service far exceeded the other services that were in the community. This reflected in a way of referrals from other clients to how good our services were, and then our revenues definitely improved from there. I hope that if you have any questions, you'll communicate them to me. It was a pleasure being able to put this team and the task force together and come out with an incredible deliverable that I believe can actually be a model for other institutions looking to provide a effective, and exciting protocol, and identifying the changes and opportunities and such. Thank you very much.